Now let's just discuss types of osteomyelitis. And the first one is acute suppurative osteomyelitis injury. So we learn that with the initiation of any carriage which progresses deep into the pulp, which will cause reversible pulpitis, which later on become irreversible pulpitis. Then it progresses downward into the radical pulp. In radical pulp, it will first cause apical periodontitis, acute apical periodontitis, then later become chronic apical periodontitis, acute apical abscess, sometimes it becomes cyst, granuloma, and what happen after that when your infection progresses deep into the bone. This infection penetrates into the medullary space of your bone. Medullary spaces of bone. And what's special about the medullary spaces is in this area we have actual blood supply of our bone. And because of that, what happened? Your bacteria stagnate small capillaries, and these small capillaries, because the bacteria is pressurizing them, it's causing a lot of pus. And why this pus occur? See, what happen is when you have bacteria into your body, your neutrophil will try to come and break down it, eat it. And when your neutrophil eat up your bacteria, they'll form pus. Your pus or suppression is basically bursting of neutrophils, right? So there is a ongoing acute inflammation within you. See, that's why it's neutrophil, because there is acute inflammation. If it's a chronic suppurative stomatitis, you will find lymphocytes. Since it's acute inflammation in this region, you will find small PMN, and this PMN will produce pus. And this pus, what it will do? It will again cause pressure. And because of this pressure, because of see the whatever all of these death and everything, the causing pus, and because of that, the blood supply to your bone is cut off, right? So it will cause decreased blood supply, basically mean ischemia. And now your bone have ischemia, and then it always progresses to necrosis, right? Whatever ischemia is basically lack of blood supply. And if there is blood supply, either it will cause necrosis, or in special organs it will cause infarction, myocardial infarction or brain infarction, right? So in bone it will cause necrosis of the bone. So now we come to the naming of the bacteria. Why we call it the osteomyelitis is acute suppurative osteomyelitis is this acute inflammation because of PMN or neutrophil, right? And why we call it suppurative? Because these PMN neutrophil burst out and this will cause pus. So when patient come to you, it will complain of patient will complain of severe swelling. Why? Because of pus, also because of inflammation. Patient have inflammation, so it will also complain of pain, redness, increased temperature. Right? It may even have a small fever, or basically we say febrile. There's going to be a severe continuous pain, which is associated most of the time will be associated with carious tooth. And this carious tooth, it also have irreversible pulpitis. So patient will give similar symptom of irreversible pulpitis like continuous pain persist even after removal of stimulus when patient change the posture, which is also known as the postural pain. Postural pain is when patient lie down, then the entire hydrostatic pressure is shifted to that particular situation, that particular position, and it will cause a very severe pain. There is a swelling, so it's going to be a demorphed or say asymmetrical face. Correct. Same thing you will find in your histology. You will find your normal bone along with a very serious amount of neutrophil infiltrate. And because there is bone necrosis, you will find a lot of dead bone, right? So in these situations, males are mostly affected by female, the acute suppurative osteomyelitis. See, usually nowadays it's just more of a male equal to female because of poor hygiene, and nowadays female also have the habit of smoking and drinking, and they lead to basically mean more carious, then more chances of osteomyelitis. Correct. Also, what all could be the cause of osteomyelitis? You know that fracture. We also discussed them in our last lectures, right? Fracture, traumatic extractions, or any amount, any carious tooth, or radiotherapy, right? Any amount of breach, which if you're introducing a bacteria to your bone, going to lead to osteomyelitis. Even a bacterium in the bone, within the bone, will cause osteomyelitis, right? In radiograph, when you took the X-ray, you will find that these are abnormal to this is CT scan, right? And this entire thing is a bone, correct? Whatever you see in white is your bone, but then in certain point you will see this black marking. This black marking is this large redundancy. See how to read radiograph is. In this scenario, we can rule out that this part is a mandible, correct? This is a esophagus. These are a vertebrae. So we know that this is the front part, this is the anterior, this is the posterior. These are lower anterior teeth, mandibular CI, LI, canines, right, and premolar. They say they are missing tooth. Here, these are root of mandibular first molar. This is medial root, this is distal root. In the same way, we can see there is empty socket, mean there is either extraction case or there is a radiolucency. In this, we can see a very large amount of radiolucency. This radiolucency is as evident as the esophagus. Basically, mean esophagus there is no radiolucency because there is no calcified structure, there is no bone. Correct? No bone, nothing here. In this part, there is large radiopaque part is this. This is your cortical bone, and inside is these all are your marrow. These are normal marrows, right? This increased darkness. This is your radiolucency. This doesn't suggest osteomyelitis. This suggests there is a lesion which is causing a pathology in your bone, a lytic lesion. Lytic lesion which dissolve your bone. When we discuss Garyostomielitis, or when we will discuss this condensing osteitis, we will see there will be an increased amount of bone, and in this there is a reduced amount of bone. That's why it's a lytic lesion. Correct. So the same way you can rule out here also. Cynostomielitis. See in this side I told you these are the root of First molar, don't assume there are two different teeth here, right? So this you will find in radiograph. What you will find in radiograph? Radiograph. On radiograph, you will find radiolucent lesion. Why radiolucent? Because it's a lytic lesion which dissolve your bone, which reduce your bone. It is not usually circumscribed. Circumscribed means round or circular. It usually have ill-defined, right? Most of the time, it is associated with, if it is associated with any tooth, it's going to be carious. You will rarely have a tooth associated with non-carious tooth. You will rarely have osteomyelitis associated with non-carious vital tooth. And what all are these rare occasions? These are, for example, trauma or accidents or radiation therapies. But most of the time, these radiation therapies also has carious lesion because of reduced amount of slavia flow. Okay, so these are the radiographs. Now, what about the treatment? Treatment of any kind of osteomyelitis, it's any kind of infection. See, there is an infection, it's suppurative, right? It's acute, mean there is a severe painful appearance. Right? The first thing is you will reduce the symptom, and it's suppurative. Suppurative means there is going to be a lot amount of pus. So for suppurative, you will, for acute part, you will reduce the pain, right? What you have to do to reduce the pain, you have to reduce symptom, basically reduce the swelling, use local anesthesia for the application, right? Local anesthesia, you have to use analgesics, right? You will administer these first. So you will reduce the pain basically. And after the pain, there is a pus. So what you will do? You will drain the pus. How do you drain the pus? You will either incise, if there is a, see the person with a large swelling. So in this case, what you do, you just give a incision. Most of the time, you are supposed to give intraoral incision, drain from inside of the oral cavity, so you don't have a scar outside of the face to prevent scar outside of the face. But if not possible, do extraoral incision. The problem is scar formation will occur and patient will have ugly scar on his face. You don't want that, right? Another thing is, if lesion is small, for small lesion, do the aspiration with syringe, correct? You're supposed to do the aspiration with syringe. After that, you will do the dressing, right? You clean out entire thing. You do the complete curettage, right? You remove everything. You even remove, just curettage the bone also and soft tissue also. You basically, I personally suggest you remove a small amount of normal bone also, normal bone around lesion, so that there is nothing involving it. See, there is no bacteria penetration within the bone to prevent bacteria penetration in the bone. Correct. After you doing the proper curettage, you drain, you just wash it out with normal saline, wash it out with, you know, flush it, flush with normal saline and betadine, or basically povidone iodine solution. Correct. After that, what you will do, you either extract, most of the guys you have just have to extract the involved tooth, basically source of infection, right? And just pack it up, okay, and prescribe antibiotics. Antibiotic most of the time just penicillins. So that's it for today's lecture. In next lecture, we will going to learn about chronic osteomyelitis and then its subsequent variants. Thank you very much. We will meet again. Peace out.